Hello, and welcome to Healthwatch Newham's very first Lunch and Learn. Our topic of focus was mental health. Over this session, you will learn a lot more about ways for residents to connect with mental health services in and around the borough, and resources that are available for you as a resident if you're considering getting support for your mental health. This session focused on 4 main topics. These were mental health in Newham, the Healthwatch Newham's Community Listening Ears project, with our focus of this set quarter being mental health. We had speakers from Newham Talking Therapies, as well as speakers from the Newham Suicide Prevention Strategy. We hope you enjoy our webinar session, and please do reach out if you have any questions or any other further suggestions.
Before I start talking about Newham Talking Therapies, I thought I'd introduce myself and share a bit more information about who I am. So my name is Rhysha. I work as an assistant psychologist in the service. In Newham Talking Therapies, there's lots of different teams. I'm part of the community team, so we do a lot of outreach work in the local area. So do we deliver educational workshops to charities, third sector organisations, businesses and schools. We also attend events like this just to sort of help spread the word about Newham Talking Therapies, who we are and what we do. But yeah, moving on to my service. Great. So the service, so we are an NHS service and we're part of the adult mental health primary care sector. We have 2 bases, so one at Vicarage Lane and one at Catherine Road, both within sort of, a stone's throw distance from each other. In terms of the support we offer, so we offer free, confidential psychological support to adults who might be struggling with mild to moderate health conditions. So these can include things such as depression, anxiety, phobias, specific types of PTSD and eating disorders. And also we can support those who may be struggling with issues which can lead to mental health problems such as stress, bereavement, loss, and perinatal related difficulties. I also want to, highlight a type of work that we can offer that not other primary care mental health services offer, but we do, and that's sort of relationship, couples or family therapy. So if you're having any relationship problems, whether that's sort of with your partner or with families, we can offer that type of support as well in terms of talking therapies. And then finally, we can support those to make adjustments with long-term health conditions. So this can include things like chronic pain, chronic fatigue, medically unexplained symptoms, long COVID, and so on. If you go on our website, and I'll share the link to that later on, we have a page which lists the range of conditions and difficulties that we can help with. So our website is another really good resource for that. So yeah, next slide, please. So in terms of our service offer, so we, I guess it's kind of the name, we provide talking therapies and we provide it in different mediums as well as different formats. So in terms of different mediums, we offer it face-to-face, and then the next few, video, the main platform that we use is MS Teams, via the telephone, and also type therapy. And in terms of the formats we offer, we can offer, of course, one-to-one work, group work, Silver Cloud. So Silver Cloud is a remote CBT program. So this is really good for people who can't commit to sort of that weekly session that we kind of require in terms of one-to-one or group work. So with Silver Cloud, if you get put forward for that, you'll get access to an online CBT program. You have it for a whole year. And you're also allocated a therapist that you could regularly meet up with, just so you're not left to your own devices. And this is really good if you need that flexibility. And if you want to, if you're not able to attend sort of weekly sessions, this is really good for that. And then I also, again, just want to highlight sort of the systemic work that we do. So instead of just focusing on helping the individual, we also do systemic work. So that involves bringing people sort of that might be linked to sort of your difficulties or situation. This might, like I said, be with your partner, a family member, and so on. So we can work in that way as well. Of course, they will need to consent to it and be open to it. But if they are, yes, we can definitely offer that. So yeah, other features of the service. So we work with a company called Language Shop. They're an interpreting service to deliver therapy in different languages. So you don't have to speak English to access our service. And also, if you feel confident in English, but you have a different native language, even if you want to do therapy in your native language, we can do that as well for you and offer therapy in that way. And we also offer interim support. So if you attend your assessment, you get accepted for therapy, there is a bit of a wait. So you'll be placed on a waiting list. And we offer interim support just to get, so again, you're not left to your own devices with no help whilst you're waiting for help. Some of the things you can access whilst on the waiting list are pre-therapy groups, webinars and wellbeing classes, and Silver Cloud, that's only for a specific type of therapy. If you're on that waiting list, that's high intensity. So yeah, you also have these things on offer. And then we also have an in-house employment team. So we can also support people who are in our service to find employment. So who might be suitable? So this is really about our service eligibility criteria. So to be eligible, you need to be, there's 3 bullet points. So be at least 18 years old, because we are an adult mental health service. We do make exceptions to that. So if you're not in education and you're 17 and a half years old or older, we can also accept you. You must also need to have a GP in Newham and not be receiving psychological support elsewhere, whether that's through public or private services. The reason for that is because we want to avoid sort of duplicating work that you might already be doing elsewhere. And also therapy can be quite an emotionally demanding sort of process. So if you're doing, 2 sets of that, we're not quite certain just how effective that would be, because it takes quite a lot out of you, and to be doing that twice isn't sort of the most helpful or would yield the best results for you. Oh, I don't think I included sort of our considerations, and I'll just to go back, that's fine, I can talk about that because I've made some notes. So there are some considerations that we do have to take into account when we receive a referral. So these are to do with sort of exclusion criteria. So there's kind of 4 primary things that we need to consider as a service. So first of all, if we have concerns about a person's ability to keep themselves safe, then we may refer them onwards to another service. It might be secondary care service, where they're more equipped to support people with those sets of needs, or it might be a crisis team. It would really depend on the individual sort of situation, if somebody might be dealing with active domestic violence, again, offering therapeutic help at that point wouldn't be the most helpful, because the priority would be safeguarding that person. So we would again refer onwards to a specialist service such as Hestia. And also, if somebody might present with substance misuse, so their mental health difficulties might be related to alcohol, drugs, or substance misuse, we'll be signposting them to CGL, because they are, again, the specialist service that would support people with those needs. And then finally, if somebody might present with either psychosis or personality disorder or bipolar, that wouldn't fit our sort of criteria around, that wouldn't fit under mild to moderate mental health conditions. That would be more towards sort of the more severe and enduring end. And those types of mental health conditions are supported in secondary care services. Yeah, so next slide, please. So yeah, our community offer. So if you feel like you're not in need of therapy, or you're not quite sure how to help us, how we can help you, just know that we also are trying to sort of support well-being even if you're not in our service. So to help raise awareness of mental health and well-being issues, we provide educational workshops. So these aren't the same as group therapy. They're more information giving, so educational, and they're for people who are, outside of our service. You don't have to be a resident to attend these workshops. Anybody living, working, or studying in Newham are welcome to attend. You don't have to have a GP or an address in Newham. So before I move on to the one-off workshops that I kind of want to advertise and plug, I just want to talk a bit about some of the running workshops that we offer each month. So we cover a range of wellbeing topics, so things like building confidence, dealing with worries, improving sleep, managing irritability, low mood, stress. Those are the topics we cover under wellbeing workshops. And then we also cover issues around long-term health conditions. So currently the issues that we have workshops on are around cardiac rehabilitation, living well with chronic fatigue, chronic pain, COPD and respiratory issues, diabetes, IBS, long COVID, and medically unexplained symptoms. So in terms of the special workshops that you can see on the slide here, so these are one-off workshops. We might run them quarterly, so we don't run them each month. And just again to mention, all of these workshops, unless stated otherwise, all ran online. The same for these ones, with the exception of the last workshop, which I'll talk a bit more about shortly. But yeah, we run a women's wellbeing workshop, parent mental health. So these are for sort of new mums and dads. We also have our LGBTQ champion, Kate Moore, who will be running a workshop focusing on mental health and the mental health needs of people within the LGBTQ plus community. We will also be running in Feb a food and mood workshop, so that primarily we'll talk about problems around emotional eating and also eating disorders. And then finally, the fear of cancer recurrence workshop. So that is one of the few workshops that we're running face-to-face that will be held at Vicarage Lane. And this is aimed for people who have completed active treatment for cancer and are in the process of sort of being discharged or being seen in an outpatient clinic. And if they're essentially having worries around sort of cancer coming back. So that is the workshop. Those are the people that this workshop is aimed for. To sign up, or if you want to know more about these workshops, on the right hand corner I've put in a registration link and also a QR code. If you scan that, it'll take you straight to our online registration workshop link. So yeah, that's it for the community offer. On to the next slide, please. Yeah, so how can you refer? How can you actually get in touch with us? So there's two main ways. So first of all, if you can speak to either your GP or another healthcare professional that you're under the care of, they can make a referral for you. The other way is to self-refer, which would be the quicker way. You can either do this by calling us on this number or completing an online self-referral form. You can find this on our website. As soon as you go on a website, on the very first page, there will be a link to that online referral form. So what happens when you've either been referred or have self-referred? So you'll hear from us in about 5 days, just to let you know about sort of about the outcome of your referral. If you haven't heard from us in 5 days, please know that you can also ring in and ask about your referral. We do try our best to sort of get back to you as quickly as we can, but sometimes we can't always do that. So yeah, please do follow up and know that that communication link goes both ways as well. Just don't feel like, you know, you're sitting there and just waiting for us to get back to you. You can also reach out to us. And one thing that I also want to highlight and just bring attention to in terms of referring is to don't wait until, you know, you've hit sort of the end point or perhaps a crisis point. If you are struggling with some of those issues that I mentioned earlier on, please don't wait until, you know, things get really bad. If you notice you're struggling with them, you know, go ahead and refer yourselves onto our service. So yeah, and then finally, I think I'm on to my final slide. So yeah, just before I take any questions, I kind of again just want to plug our social media accounts because we are doing a bit more on there to boost our social media presence. So we're advertising the workshops that we do on there just so it can get out to the local community that way as well as spreading it through the word of mouth and attending these events. And also we're sharing some of the service projects that, you know, we're starting to set up. One of them is sort of, we've identified that in our service there's a heavy underrepresentation of young Black men. So not enough people from, you know, that community who identify with that demographic are accessing our service. In fact, they're overrepresented in more severe severe mental health services or inpatients. So we're doing our best to reach out to that local group more. So we'll be advertising more about that, and if you want to get involved. But yeah, in terms of our socials, we're on Facebook, Twitter, and Instagram. So yeah, if you do give us a follow on there, we'd really appreciate it.